Now at noon, the coronavirus is front and center as new cases pop up across the country, including in New York and in Rhode Island. Governor Lamont, the U.S. Surgeon General, and other state officials talked about what they are doing to combat the virus here in Connecticut. So far, there is 1 confirmed cases of the coronavirus in New York. 2 are in Rhode Island. At least 1 is in Massachusetts, 2 in Florida, and 2 people have died from the virus in Washington state. Now, on Friday, the state's public health laboratory in Rocky Hill was given the green light to conduct coronavirus testing here. And that is where we find Chief Capitol reporter Susan Raff live with what the U.S. Surgeon General is now advising. Susan?
Kara, good afternoon. U.S. Surgeon General Jerome Adams came to Connecticut. He got a tour of Connecticut's public health lab, and he was pretty pleased, saying that Connecticut seems to be on the forefront as far as protecting people. As you mentioned, they started testing here for the coronavirus on Friday. This is where they test for many infectious diseases. Now, the U.S. Surgeon General had some advice, many of the things that we've been hearing for the past few months, and that is we need to be more diligent about washing our hands and using hand sanitizer, and the greeting that we do with shaking hands, he suggested against that. But he did have some advice about face masks. As you know, a lot of people have been rushing to stores buying them, and he's not in favor of that.
Folks who aren't comfortable wearing a mask will often touch their face more frequently and adjust the mask, and can actually increase their risk of exposure to flu or coronavirus. So you may actually be harming yourself and putting yourself at increased risk by wearing a mask. If we actually utilize masks inappropriately in the community and in the general public, they won't be available for healthcare workers who actually need them to respond.
The U.S. Surgeon General also made a big push for vaccines, mainly the flu vaccine, saying even though we seem to be moving out of the flu season, the fact is some 18,000 people have died so far from the flu, and that if people have the flu and are exposed to coronavirus, it could be a lot worse for them. So he is recommending that people still get flu vaccines. Now, no cases so far have been reported in Connecticut, but that could change, and in fact, they suspect that it might as we see more and more cases. It could come to the point where Connecticut cancels large events or even closes schools, but that is not the case right now. But it is something they are thinking about if we see, in fact, infected cases or people with infection of the coronavirus. That's the latest from the Public Health Lab. Susan Raff, Channel 3 Eyewitness News.
All right, thank you, Susan. Some good information. We just have some new developments in the coronavirus. New Hampshire has just announced its first case of the coronavirus. We're being told that that person did travel to Italy. We will keep you updated as more and more cases are discovered. You'll find everything you need to know about the coronavirus right on our new Channel 3 app, including information about the virus, the precautions that you should be taking, and breaking news and updates about the outbreak.